Hello, we're going to talk about the skill mastery and rationale for sterile technique. This is a part of asepsis and the difference between medical asepsis, as we've reviewed before, and the process of surgical asepsis, which is also called sterile technique. Our mission moment, okay, because we're focusing on doing a skill here, is attributed to Benjamin Franklin. Tell me and I forget, teach me and I remember, involve me and I learn. So I want you to challenge yourself here. If you've done the reading beforehand, you should know how to do this. One of the key principles of maintaining sterile technique or asepsis is to be able to appropriately use the materials that are designated as being sterile, and one of them which is opening a sterile package. So there are specific steps for opening a sterile package, and you need to be able to know how to do that because this is skill that you will be tested on throughout the semester. So if you don't know this, go back and review it so that you can accurately predict how you will put in the numbers on these lines here for steps for opening a sterile package. All right, so we're going to talk about the difference between medical asepsis and surgical asepsis. Medical asepsis is what we've reviewed before, and it's about the difference between objects being clean and dirty. So when we talk about infection control, for example, that's part of medical asepsis because it differs from surgical asepsis where everything is sterile. In medical asepsis, you're trying to reduce the number of microorganisms that get transferred in the client's environment. But in surgical asepsis, the key is to keeping the area free from microorganisms. So that's the difference. Sterility means the absence of microorganisms. There's lots of key principles about sterile technique, and this is all well documented in your book. But keep in mind that for starters, if a sterile object touches a non-sterile object, then that sterile object no longer remains sterile. Okay, so you can't contaminate the sterile area with something else. And there's a magic area that we look at when we look at a sterile field, and usually about 2 inches around the outside of the sterile field is considered not sterile. So it's like a little DMZ, demilitarized zone. So you can't use, you can't put anything in that 1 to 2 inch border. So keep everything in the middle of your sterile field. Another principle of sterile technique is that a wet object is not a sterile object because the wet can soak through um, the surface and contaminate objects. So keep that in mind. So for example, when you're pouring fluid onto a sterile field, you don't want to splash it. And all the objects in the sterile field have to be sterile. So you can't put anything that isn't considered sterile. For example, a pair of exam gloves, you can't put that onto a sterile field. They have to be sterile objects. And skin is not sterile. More techniques to recall is that anything that is out of your line of vision is not sterile. So if it's behind your back, if it's below your waist, if it's below the edge of the table, it is not considered sterile because the rationale is you can't see it, so therefore you can't control it. Another key point to remember is that packages are sterilized, for example, with sterile towels, sterile dressings, whether they be absorbent pads or wrap type dressings, um, are packaged and considered sterile on the inside, but the package has to be intact. So if it's damaged, it can lose its sterility. So you have to examine the package and look, does it look like it's been properly stored? You know, the packages usually are white. Does it look like it's been sitting out in the sun for 10 years? Just because it has a current expiration date on it doesn't mean that it's still sterile. So you have to inspect the package and make sure that it is actually sterile. So your textbook goes over all of the skills about how to do this, as well as your ATI. And this is one of those things that you really just have to do. I cannot emphasize enough that you have to practice how to do this because it's not something that you can read just learn by by reading the book. So you have to do it. Of course, you do need to know the general principles behind it and why you're doing something. But it's one of those skills that you need to practice. So when establishing and maintaining a sterile field, the purpose of it is to make sure that those sterile items that you put on the tray stay sterile. You have to plan ahead, make sure that you gather all of the equipment and everything ahead of time, and knowing that you have um, everything there is important because if you have to step away, then you lose sterility on the field because it is out of your line of sight. So making sure that you've gathered everything that you need specific for that experience. Look at that. There's the package. Okay. Take a look at how to open that package because it's important. The textbook does a very good job of going over how to do this. So first you open the top flap, then you open the sides, and then you open the bottom flap right here to uh, as the last step, such as this, making sure that when you pull it that last flap towards yourself that you grasp on the corner right here underneath. See how it's sort of folded over on the top. You don't want it to, see if I can draw it. You want to make sure that it's right there. Okay. Let that be noted so that you can make sure that you do it. Now in this package here, opening a wrapped package while holding it, see how they're holding it at the corner there. It's folded over so you're not touching the inside. And this is very convenient because now somebody with sterile gloves could reach in here and grab the towel as needed. Another variation of preparing a sterile field is to use a wrapped package there to pull it open. You sort of butterfly it open so that the contents stay sterile so that you're not touching it. As you see, on this package here, you can open it by pulling it apart on the ends, and that is another way of being able to keep the package sterile. It takes some practice, and you'll get some opportunities to do that in lab as well. Here's a package that has a sealed corner. Right here, you can see how they're opening the package, and here's the corner that they pull back. This is the proper way to open a drape and be able to place it down on a surface by holding it up at the corner there and making sure that it doesn't touch any objects because then it would become contaminated. Again, practicing this in lab will be the best guide that you can do. I don't want to spend a lot of time explaining it to you because I think you can read it in the book and watch it on ATI videos. It makes it a heck of a lot more easy to understand. Key thing here is that see how this is when I was talking before about preparing the package, like dumping it onto a sterile field, and you keep the hands away from the inside part of the package here. All right, and then it goes into the bowl. When you use such a container there to pour in liquid, you want to make sure that you don't splash it on your field, because then, as you recognized before, that a wet surface allows uh, microorganisms to wick up from underneath. So you make sure that as you're pouring this into here, the fluid goes in here with a 4x4 or a gauze pad, and it helps to prevent it from splashing out of the bowl and onto the surface. So that's a key point that you want to remember. There's some different equipment that you can use on a sterile field for grabbing, such as these here. These are called hemostats. On the left-hand side, you have straight hemostats, and on the right-hand side, there's curved hemostats. They're very useful for grabbing and holding objects. Here you'll note at the top of the sterile field instructions here, it talks about when you are putting fluid into the sterile field so that it doesn't bounce all over the place. You want to hold it at a height of 10 to 15 centimeters or 4 to 6 inches above the bowl, and that will help to prevent it from splashing. As you use a container of fluid, once you open it, it's no longer sterile, but you can save it so that the fluid can be used for clean procedures. And as you're finishing up using that bottle, you want to tilt the neck of it back quickly so that none of the water drips down the side of the bottle into your sterile field again and contaminating it. More pictures of forceps, and you'll get to practice using those as well. If they're metal forceps, they are usually recycled and autoclaved, but if they are plastic, they are generally considered disposable. I put this picture in here for a reminder for you to know the difference of when you are using different kinds of forceps and when you keep the hand down and when you keep it up, all of which you will get to practice in lab. There is the instructions about how to open packages with the flap away from you, then the two sides, and then the fourth flap that is closest to you. So here's some good practice. Take a look at this and see what's wrong with this picture. See what you can identify. If you need to, pause so that you can examine the picture thoroughly. Okay, take a look at this here. What's going on? There's a break in sterile technique. Okay, so why are those hands there? Because remember, one of the key principles of sterile technique is that everything has to be visible. So if your hands are out of your line of sight, then they aren't considered sterile anymore. They are supposed to be above the waist, but below the axilla, right there. Here's another. This indicates a safe area. Is it safe? As long as you can see it, yes. Sometimes drapes are used to establish a sterile field, such as when you are using a drape in doing a urinary catheterization. Just remember, key principles are you don't lean over top of the sterile field once you have created it. Some more instructions about how to use commercially packaged supplies, most of which are supplied in an inpatient setting. As I mentioned before, once a liquid has been opened, it's no longer considered sterile, but you can keep it for 24 hours for clean procedures. So whenever you open a bottle like that, you get a Sharpie marker and you put the date and time on it with your initials so that they can be identified for use later. And also remember that sterile objects can become unsterile by prolonged exposure to airborne microorganisms. So even if you set up a sterile tray, that doesn't mean that you leave it for 8 hours unexposed. Sterile setup should be done at the time that it's needed. Remembering some don'ts about sterile fields: don't lean across it, don't cross over top of the sterile field, and don't cough, sneeze, or talk over top of a sterile field. Key principles. More instructions again about how to open sterile supplies. And remember that when you're going to use sterile gloves, that you need to remove all rings, especially those that have stones with high profiles and can actually tear the glove. Hand washing is imperative, and actually there's a surgical scrub that if you're in the operating room, that is done prior to putting on sterile gloves. For procedures that are done on a nursing unit, thorough hand hygiene is appropriate. Making sure that when you place the package of sterile gloves, it's down on top of a clean, dry surface. You don't want to put it on top of anything wet, because then the moisture will wick through and contaminate the gloves. Making sure that the package is intact and ready for use. Now again, it's easy for me to explain, but it's one of those things that you have to practice. There's a difference in procedure for putting on the first glove and the second glove. And I have some videos posted online that I want you to watch and identify some of the errors that are done, and that'll be part of your assignment. When you're doing a sterile procedure, you want to take into consideration what the environment is. Especially in a home setting, you want to make sure that that everything is clean. Sometimes nurses will create a barrier between s- surfaces in the home and the sterile contents themselves, such as layers of newspaper or uh, disposable pads, something like that. But the environment can be dirty as well if there's plants in the room, or if there's old food, or the bedpan has been on the bedside table, which I've seen many times. That's not an appropriate choice to set up your sterile field there. But we use sterile technique when we're doing invasive procedures, such as in the urinary tract where we do a catheterization, and in the lungs when we do tracheal suctioning, and any time that there's a break in the skin. Sorry about that. So when we talk about breaks in the skin, that is either a surgical wound or chronic wounds. And chronic wounds are considered contaminated, and therefore sterility is not required. But if it is a open wound that was done recently by surgery, you would do sterile technique. And you would also do sterile technique when you're dealing with patients who are particularly vulnerable to infection, such as patients who have a low white blood cell count, cancer patients, patients who are taking steroids or some sort of condition that's going to change their um, ability to fight off infection or their level of immunity. And but whenever you're doing clean technique for uh, wound dressing, it should be meticulous. You should not skip cut corners. So some of the concepts of sterile technique, they have to be very conscientious and humble when you are doing these procedures, because it's very easy to mess up, and you have to uh, make make yourself aware of those mistakes, that and be honest about it, because uh, the person who's going to suffer is going to be the patient if you use contaminated objects. And a good tip for beginning nurses is to bring extra supplies into the room as much as possible, because there's always a chance that you're going to goof it up. I always, even for myself, bring in a couple uh, extra pieces of equipment. If it's an isolation room, I'll leave it outside so that it's at least close to the door if I should need the equipment. And key thing to remember is that these are things that you're going to have to practice, practice, practice. Practice putting on sterile gloves. It's not the same as doing clean gloves. Practice opening those sterile packages, setting up the sterile field, and adding liquid to a sterile field, because it's very easy to have it bounce all over the place. So that concludes the lecture on asepsis, and I hope it was helpful. Thanks.